What college sport and playing position within that sport, if applicable, defines your athlete? For each of the 4 main lifts that you chose to have your athlete do in your training program, explain what their 1 rep max for the exercise is, and also give mention to your athlete's training age.
Our college sport of our athlete is swimming. They are a short distance swimmer in the 100-meter freestyle. Our athlete has a training age of 2 years. Our athlete's 1 rep max for the bench, back squat, deadlift, and shoulder press is as followed. The deadlift is 205 pounds, shoulder press is 85 pounds, bench press is 125 pounds, and back squat is 185 pounds.
Which injuries are most common to athletes in the sport and playing position, if applicable, and how do the physical demands of this sport attribute to these injuries occurring?
The most common injuries in the sport of swimming include irritation and inflammation in the shoulder, rotator cuff tendonitis or tears, shoulder impingement syndrome, due to the pressure in the shoulder and the rotator cuff whenever the shoulder blade is lifted above the head, tears in the cartilage around the shoulder, neck and low back pain, and finally the bicep tendonitis. A lot of these injuries are due to overuse and caused from rigorous use of the shoulder and arms in swimming. Swimmers will accumulate about 2 hours a day of swimming and then add more training in the weight room as well. With such high volume to the shoulders can easily become overworked and cause such tears, and tendonitis can occur. Explain which energy systems and muscle fiber types your athlete is most dominant and relied upon, which primary movement patterns their sport and playing position requires of them.
The energy system utilized by our athlete is the glycolytic system and the phosphagen system. Since our athlete is a short distance swimmer, they do not enter into the aerobic system of the oxidative system. The phosphagen system provides ATP for short-term, high-intensity activities such as the 100-meter swim. This energy system relies on the hydrolysis of ATP and the breakdown of creatine phosphate. The glycolytic system breaks down carbohydrates to resynthesize ATP. The glycolytic system results in pyruvate, which can be converted to lactate or shuffled into the mitochondria. When the pyruvate is converted into lactic, ATP resynthesis occurs at a faster rate. And when pyruvate is moved into the mitochondria, the ATP resynthesis is slower because of numerous reactions. The muscle fiber types used by our athlete are type 2A and type 2X. Type 2 muscle fibers are characterized as inefficient and fatigable and as having low aerobic power, rapid force development, high myosin, ATPase activity, and high aerobic power. Type 2A muscle fibers have greater capacity for aerobic metabolism and more capillaries surrounding them, which allows for greater blood flow to the muscles. While type 2X muscle fibers are more resistant to fatigue. The primary movement patterns in which our athlete performs in is the transverse plane as their shoulder rotates as they move their arms through the water and as the athlete rotates when taking a breath in the water, along with the frontal plane, such as when the swimmer is moving through the water and keeping it.
Explain in your own words why the 5-3-1 training structure, either option 1 or option 2, is effective for building muscular strength in an athlete. You should support your answer primarily by drawing from your understanding of the concepts we have discussed in class regarding training to develop muscular strength. Refer to your lecture notes, PowerPoint slides, and textbook reading. You can also draw from the 5-3-1 PDF reading as well.
The 5-3-1 program allows for progressive strength development in athletes through cyclic progression of each lift. As the cycle progresses, the rep ranges decrease while the percentages increase at those rep ranges. The 4th and final week of the cycle is known as a deload week, which allows the athlete's body to recover and settle back before testing their 1 rep maximum again. As the athlete performs the program, their body is progressively put under stresses to increase their overall muscular strength as well as central nervous system development, which is demonstrated at the higher percentages and when asking the athlete to perform 5+ reps, 3+ reps, or 1+ reps at set given ranges.
Following.
Considering what you have researched about the common injuries seen within athletes of the sport or playing position, how did this affect your exercise selection? In other words, give a defense or rationale for how certain exercises that you chose to integrate in the training program will specifically address injury risk reduction for that athlete. You do not need to give a defense for every single exercise in the training program. Instead, I require that you provide this rationale for a minimum of 4 total exercises.
Seeing that our athlete is prone to having injuries such as tendonitis and tears in their rotator cuffs and lower back and neck pain, we focus on programming exercises to strengthen the musculature of these areas to ensure a stronger foundation to fight against these types of injuries. We chose the exercise of external rotation with tubing to ensure that our athlete works this range of motion and strengthens the stabilizing muscles within the shoulder. As our athlete performs these exercises, both ranges of motion, internal and external rotation, are worked and strengthened. We chose to use higher rep for hypertrophy-like training for this exercise to ensure the muscles are properly fatigued and utilized. These exercises will help as rehabilitation exercises to reduce the risk of shoulder tendonitis and tears. Another exercise we chose for our athlete helps to promote strength through their posterior chain and allows for a reduction of risk to lower back. The single leg kettlebell RDL helps to isolate each side of the body and bilaterally train the body, along with strengthening the posterior chain. When training bilaterally, it helps to decrease the imbalances within the body and allows for the athlete to not only have more equal bodily power, but also more equal bodily stability. Since lower back pain is common among swimmers, strengthening the posterior chain allows for our athlete to have less of a risk of lower back pain. Lastly, another rehabilitation exercise set we chose was the bent over row and reverse flies, both with dumbbells. The combination of these exercises again helps to strengthen the overall shoulder girdle and allows our athlete to have a decreased risk of shoulder injuries due to the overall increased strength and stability of the shoulders from these movements.
Given your athlete's training age, explain how you made this consideration for your exercise selection.
Since our athlete has a training age of 2 years, we use this in consideration of what movements and volume in which the athlete would undergo. Since the athlete is fairly familiar to the weight room and has some experience lifting weights, we felt comfortable programming lifts such as the deadlift, for one example, at higher intensities and volumes as opposed to someone with a younger training age. Although our athlete has been swimming for much longer than 2 years, their training age within a weight room in a strength and conditioning setting puts them at a 2-year-old training age. This made us comfortable that they were familiar to movements and lifts with this setting, however, that they still have a relatively young training age.
Considering the primary movements of the sport, explain your rationale for how at least 4 of the exercises that you have incorporated in the training program can help improve your athlete's athletic performance. Consider the physical demands of the sport, which energy systems are predominantly at play, and which muscles are primary contributors to the main movements of their sport and playing position.
Our primary movements in our sport include transverse and frontal planes of motion, which has us focusing our movements to strengthen our athlete's core, leg drive, and shoulders for rotation. For power development and movement in the frontal plane, we chose to program box jumps. This movement allows for explosive power to develop in our athlete, which produces a greater leg drive in our athlete and therefore allows them to swim faster. Another movement we used, which focuses in developing strength in the muscles utilized in the frontal plane of motion, would be the banded kettlebell swings. This movement again allows for our athlete to develop vast amounts of power along with strength to increase the drive through their legs when swimming. To develop strength in the transverse plane of motion, we chose as one example the movement of the side plank. This allows our athletes to develop core strength and stability through working anti-flexion. This is vital to our athlete when swimming because of how they rotate in the water when taking breaths when swimming. Lastly, our 4th exercise, the medicine ball side toss, allows the transverse plane to work, but also works rotary movement. This movement allows our athletes to develop not only core strength and stability, but power through their core to increase efficiency in their movement patterns.